The terrain trial was designed to compare bicalutamide, which is the previous anti-androgen, first generation, compared to enzalutamide, which is the latest generation of an androgen receptor signaling inhibitors. And so they were looking at efficacy in this trial. And so it was a large trial with 375 patients comparing, one-to-one randomization bicalutamide to enzalutamide. Now, in preclinical models, we found that enzalutamide was very effective because they used bicalutamide-resistant cells. And so we have preclinical data comparing those, and now we have level 1 clinical evidence showing that there's an increased efficacy of enzalutamide versus bicalutamide. So there were 375 patients, as I said, and the primary endpoints were progression-free survival, and secondary endpoints were the change in PSA as well as quality of life indicators. And so for the progression-free survival, the primary endpoint, it was longer by about 10 months. So that there was a 15.7-month progression-free survival in the enzalutamide group versus 5.8 months in the bicalutamide group. And then there was higher PSA response in the enzalutamide group, so that when you looked at a decrease of PSA by 50%, there was 82% in the enzalutamide group versus 21% in the bicalutamide group. And when we looked at PSA of greater than 90% decrease, it was 56% in the enzalutamide group versus 5% in the bicalutamide. And then when you look at quality of life indicators like the FACT-P, patients had a longer time to deterioration in the enzalutamide group versus the bicalutamide group by about 5 months. And all the indicators in the FACT-P were better in the enzalutamide. So that what this trial has shown is that that enzalutamide has a much higher efficacy rate than bicalutamide.